I'm Lisa Pickering. Welcome to CITV's Press Talk. Here's the most recent news and information from the government of Bermuda.
Good afternoon, and thank you for being here. The Ministry of Health and Seniors is implementing the multi-year strategy to reform the health system in the Bermuda Health Strategy and Action Plan. Our goal is to deliver affordable, sustainable, quality health care for all of Bermuda residents. Today, I'd like to talk about some of our initiatives. The future health care needs of our community are being determined by the changes we see in the disease patterns and the demographic shifts in our aging population. The onset of chronic non-communicable diseases, NCDs, such as diabetes, heart disease, happens at an early age in Bermuda. For example, 3 out of every 4 adults are obese or overweight. This can lead to serious medical problems that can have a terrible effect on the individual. But that's not all. The nationwide medical problems can impose a serious cost burden on the healthcare system. This is our greatest concern. We also need to deal with the needs of Bermuda seniors and people with physical and cognitive or mental disabilities, such as dementia and Alzheimer's. Put it simply, there are more seniors than there have ever been, and our people are getting sicker with lifestyle-related diseases at a younger age. This double demand has put considerable strain on our healthcare workforce, our families, and our finances. This is a critical time for Bermuda as we plan for a healthier future. That is why the ministry is actively pursuing 3 major initiatives. 1, the Premier's Council on Fitness, Sports and Nutrition, which educates children at an early age about health and fitness to help prevent the onset of lifestyle-related non-communicable diseases. 2, the Long-Term Care Action Plan, which addresses quality of care needs, the implementation of healthcare staff for long-term care, the development of healthcare staff, and also the educating of the public about long-term care issues. We have a variety of initiatives designed to keep seniors in their homes as long as possible, where they're happier and healthier, and thus freeing up the beds in residential care facilities for those who need them most. Other initiatives include a chronic disease register. Chronic diseases such as diabetes, kidneys, and heart disease place an increasing burden on our healthcare systems. Knowing the hard data, which will be compiled by both the public and private healthcare practitioners, will help us plan for the future. BHB will establish a medical home program to reduce revolving door or repeat hospitalization and inappropriate care, use of emergency services to control chronic diseases. Following the successful amendments to the Pharmacy and Poison Act 1979 and the Misuse of Drugs Act 1972, government will consider allowing herbal supplements containing cannabinoids to be imported. The ministry will also work with the long-term care system to ensure affordable and financially sustainable care, including the development of private sector incentives in the development of long-term care. My government believes that this year's throne speech initiatives will include things that will provide the support that is critical to our population. I invite you to ask any questions about the initiatives outlined in my ministry, because I believe there are lots of them, and I believe that the people of Bermuda, when they hear about them, will realize that we have things designed to not only deal with what's happening now, but we have put a plan together to deal with things in the future, and we're going to make them understand the role that they can play in helping us get better, healthier, happy people in Bermuda. So please ask questions, because we want the people of Bermuda to know what we're going to do.
You haven't brought up the cost of healthcare, which is obviously a major headache issue for your government. But the acts that you're putting through Parliament at the moment, which are so controversial with the doctors, is directed in that regard, is to help you with your cost controls. Where is that going to go this year?
Well, when you say I haven't brought up about the cost of health in Bermuda, it's because I'm trying not to make people focus on health, because the thing that drives health is illness. And if we can get healthier people, then we can reduce the cost of health care. So I'm trying to take people away from the cost, because there's a feeling that you're only focusing on cost, when really we're focusing on quality. We're focusing on what can people do to make themselves healthier, what can they do to make sure that we don't utilize the services inappropriately, what can we do to make sure that they understand what their issues are, what the physicians are, the role they play in terms of the team to address these, and make sure that they start to say, what can I do? How can you help me? How can they monitor that? Because if they can see themselves improving, their health improving, hopefully they'll also see the cost of health going down, and that will be the double improvement.
But the Health Council campaign and legislation that's going through Parliament at the moment, I called my doctor this morning and said, what question should I ask the Minister on your profession's behalf? I take out all the rude words that he said. What he asked basically was, why are you letting a group of amateurs tell professionals how to conduct their own business? And why aren't you attracting or attacking more the greed of the insurance companies and their shareholders? Do you have a response to that?
I do have a response for that, but I do believe that deserves its own response, because there are so many things associated with what you just asked that perhaps at a future time, if you'd like to arrange something with Catherine, we can have that discussion. But I will just go back to what this is all about, because the Health Council reminds everybody, but any initiative that we're doing are based on quality. They're based on the care. They're based on what can we do to improve it. And I remind people that we have lots of people out there working in the healthcare system, working in terms of people that sit on the boards, the Health Council board, the hospital board, and they have doctors, they have persons from all sorts of disciplines, because it isn't just about one group of people. The health in Bermuda is influenced by the things that they do, the things that you eat, the things that you don't do. So I keep reminding everybody that healthier Bermuda is going to be a change in your lifestyle. It's going to be a change in how much activity you have. It's going to be a change in your nutrition. It's going to be a change in sometimes hereditary things. And so when you think about some of the things that we're doing, which is like the chronic disease data registry, that's us going out and saying the more information that we get about why things happen in Bermuda, how come people are getting certain things earlier than other places, what can we do? That data helps us to turn around and influence our result and decide what resources are going to be required. So I try not to focus on cost, because when you do that, people think that that's the only thing that drives it, and it's not. It's driven by care and quality.
Thank you.
A lot of the initiatives you're talking about are longer term ones. What are we doing, again, to bring back to the issue of cost? I hate to do this, but what are we doing to make sure that people who are right now looking at extremely high medical costs, to make sure that they don't have to do that in the future?
Well, I mean, I think one of the initiatives.
Future, I should specify.
Pardon?
The immediate future.
Well, one of the initiatives that we have going on, which I think is important, is first of all, we have the aging at home. So we're trying to make sure that people can stay in their home. That means that they don't have to have as much expensive treatment. We also have the BHB initiative, which is the medical home program. Those are the people that have been at the emergency. They're coming back and they're going in and out. They will then have that type of not only care, but they will have the case management that they need. And so some of these things are immediate. Most of them, as you recognize it in terms of the NCDs, it's even about. We're working with our partners like the Diabetes Association. We're working with other people to say, even right now, if you can figure out what you can do differently, that impacts on the amount of doctor's visits. It impacts on the amount of medication. And sometimes people are able to move from medication to actually changes their lifestyles and reducing their costs. So everything is designed to be put together in the plan, but the other initiative which we had, which is talking about the 1 year, that is looking at the people aging. We're determining what can we do in terms of making sure that if you don't need to be in a rest home, if you can be at home, that reduces the cost. Where we have the the benefits that we allow caregivers to be able to care people for at home, and provided they are properly qualified, that reduces that. So I think that everything is immediate, but some of it is going to take a longer time for you to actually see the result. But it's all being worked on simultaneously.
With the growing risk of diabetes on the island, is there been any further thought on an idea of a sugar tax in Bermuda?
Thought, yes, but part of the thought relates to gathering data and information to determine, does it really work? And so, we've been looking at, does it work in other places? Does it result in more bureaucracy, people having to turn around and add to the cost by trying to figure out who you're going to tax, really get it from, and does it drive it up? Or do you try and start to doing more of the education, making people understand about the fact that, water is very good. Water actually does a lot for you. Water doesn't actually cost a lot. So we have to start educating people not only about what they eat or drink, but also a lot of people don't understand about where sugar comes from. Sugar comes in lots of other things that you don't actually believe has sugar in it. So we have to educate people that it isn't just about the sugary things that you drink, it's also about other things that you perhaps eat in greater numbers, greater amounts than you should, and if you cut down on that as well. So we work with the Diabetes Association. We have actually programs to start to make sure that we do things differently, and I guess that allows me to segue into what we're doing in terms of the Premier's Council, because it's about understanding that if you can get people to be healthier, younger, you develop these good lifestyles, and then later on, they're better adults, they are healthier adults, and we see that the obese, overweight children that we have means that we didn't get it right early enough. So now by doing this program, in the Premier's program, we can then start to make sure that at that level, we start to make sure they're having more exercise, we make sure that we get them fitter. And so it's all related. It just doesn't start just with the sugar, it starts with what we do and how we program and act ourselves.
From personal experience, I would like to say the bright star of your new urgent care wing has to be the dialysis unit. But no one can avoid looking at seeing how that operates and realize that we have a major health crisis going on in Bermuda, probably much greater than anyone expects, certainly in terms of cost. How is the dialysis unit working for the hospital and for the government, and where do you think it's going in the long term?
Well, it's interesting that you should say that, because it's good to have the dialysis unit, but like everything else, the way you stop the water flowing is to stop the amount of water coming to the tap. So what we've been doing, we've been starting to make everybody understand that you have to appreciate the factors that get you to have renal failure, the factors that that are high blood pressure, the cholesterol, those other things. So we're really putting lots of emphasis on making people understand the factors, understand whether some of them are hereditary, but a lot of them are actually related to things that you can change. And that's where educating the doctors and the doctors educating their patients and keeping abreast of going to your doctor so that they can sort of say to you, okay, well, your diabetes is under control, or your blood pressure is coming down. That's the way to stop people having more failures. And in the meantime, as I say, in terms of turning off the tap, we are obviously working with the physicians, working with the hospital to deal with things like peritoneal dialysis instead of just hemodialysis, looking at our people candidates for kidney transplants and things like that, because there's no one solution, but all of those things. Can you imagine if we could turn around and prevent somebody from going on dialysis? Not only do you actually reduce the cost, but more importantly, you actually make their lives better and longer, and we don't turn around and result in them having to be attached to a machine, which is life-saving, but it still is something that you have to do, which creates something that impacts negatively on the healthy lifestyle that we'd like for them to have.
You've been watching Press Talk right here on CITV. Join us next time for all your government news and information. I'm Lisa Pickering.